Is it normal for a fetal pole not to be visible during early pregnancy?
Hey there! Welcome to today's video where we'll be discussing whether it's normal for a fetal pole not to be visible during early pregnancy. If you're experiencing concerns or have recently had an ultrasound that didn't show a fetal pole, stick around as we delve into this topic and provide you with some important insights.
What is a fetal pole?
To start off, let's clarify what a fetal pole is. The fetal pole refers to the early development of the embryo, specifically during the first few weeks of pregnancy. It's essentially a thickening in the center of the gestational sac, and it contains important structures such as the yolk sac and the beginnings of the fetal heartbeat.
When should the fetal pole be visible?
Now, you might be wondering when the fetal pole should typically be visible on an ultrasound. In most cases, the fetal pole becomes visible around 5 to 6 weeks of gestation. At this stage, it's often possible to detect the embryo's heartbeat as well. However, it's important to note that this timeline can vary, and it's not uncommon for the fetal pole to be seen a bit later, especially if the ultrasound is performed very early in the pregnancy.
Factors affecting fetal pole visibility.
There are several factors that can influence the visibility of the fetal pole during early pregnancy. One factor is the timing of the ultrasound. If the ultrasound is performed too early, the fetal pole may not have developed enough to be visible yet. In such cases, a follow-up ultrasound after a week or two is usually recommended to allow for further development and a clearer view. Another factor is the quality of the ultrasound equipment used. Lower resolution or less advanced machines may have difficulty capturing clear images, which can affect the visibility of the fetal pole. In some cases, the positioning of the embryo within the uterus or certain maternal factors, such as obesity, can also make it challenging to visualize the fetal pole during early pregnancy.
Possible causes for concern.
While it's often normal for the fetal pole not to be visible during early pregnancy, there are some instances where it might raise concerns. If multiple ultrasounds have been performed, and there is still no sign of a fetal pole or heartbeat beyond the expected timeline, it's important to consult with a healthcare professional. They can evaluate the situation further and provide appropriate guidance based on your specific circumstances.
The importance of follow-up.
Lastly, it's crucial to emphasize the significance of follow-up appointments and discussions with your healthcare provider. If the fetal pole is not initially visible, it doesn't necessarily indicate a problem. However, monitoring the development of the embryo is essential to ensure a healthy pregnancy. Your healthcare provider will guide you through the process, determine the appropriate course of action, and provide the necessary support and reassurance along the way. In conclusion, it's generally normal for the fetal pole not to be visible during early pregnancy, especially if the ultrasound is performed too early. Factors such as timing, ultrasound equipment quality, and maternal factors can all influence the visibility of the fetal pole. However, if there are persistent concerns or multiple ultrasounds show no sign of a fetal pole or heartbeat beyond the expected timeline, it's essential to consult with a healthcare professional for further evaluation. Remember to keep up with your follow-up appointments and trust in the guidance of your healthcare provider throughout your pregnancy journey. Thanks for watching today's video. If you found this information helpful, don't forget to give it a thumbs up and subscribe to our channel for more.